So this evening we're going to start by hearing from David, who's joining us all the way from Zambia. So thank you so much, David, for being able to join the call tonight. David has said that there's a storm going on this evening, so it could be temperamental. We might hear thunder in the background. But David has been at Chitokoloki for over 25 years now, I think. He went out with his wife Lorraine and their three sons. But David's going to share a bit of news about Chitokoloki this evening and ways preparing for the hospital as well. So David, over to you. Thank you so much. If you're able to unmute as well, sorry. And you can share your screen. But yeah, thank you so much, David.
What time do I finish?
Whatever time you like, you can stay all evening. You're 2 hours ahead of us, so that's fine. I mean, if you can aim for about 8 o'clock, that would be brilliant. But yeah,
Okay.
no pressure. So you're going to be more tired than we are. So.
And how do I get my slides back? I just click on it, I think, don't I? Yeah. So can I go ahead?
Yeah, the floor's all yours, David. Thank you so much.
Okay, thank you. Okay, good evening, everyone. And it's nice to have the opportunity to speak to you all. And thank you for listening in. I have just a few words to say tonight, not too many, but it's about Chitokoloki. Uh, as you know, Chitokoloki Mission Hospital. I'll take this opportunity, first of all, in case I forget, to say a word of thanks to Medical Missionary News, who have been a tremendous blessing to us and our patients over all the years. We were about 10 years in Congo and then 24 or so here. And Medical Missionary News have provided a huge amount of the support in medical supplies during that period. And many lives have been saved through their through this ministry. So we thank you for your prayers and your support. Um, I could have just a read from Luke chapter 10, 33. But a certain Samaritan, as he journeyed, came to where he was, and when he saw him, he had compassion on him. Compassion. 34, he went to him and he bound up his wounds, pouring in oil and wine, and set him on his own beast, and brought him to an inn, and took care of him. And on the morrow, when he departed, he took out 2 pence and gave them to the host, and said unto him, Take care of him, and whatsoever thou spendest more when I come, again I will repay thee. That's care, compassion, and care. And then, for we preach not ourselves, from 2 Corinthians 4 and 5, for we preach not ourselves, but Christ Jesus the Lord, and ourselves your servants for Jesus' sake. Just leave three little thoughts with you there: compassion and care in Christ Jesus the Lord. And we hope that those three words encompass much of our work here at Chitokoloki, and it should indeed be three things that characterize us as followers of the Lord Jesus, wherever we are. We should always have compassion for people who are in need. We should always have a practical care for people who are in difficulty, and we should always present them with the message of the gospel. I just want to leave a few little thoughts here. I don't know whether Graham might agree with this. I hope he does. But indigenization and sustainability, they're two words that I don't like when it comes to medical missionary work. And they have unfortunately taken a bit of a grip at times in recent years, in even amongst our own works. But they're very terrible words as regards medical missionary work. And we saw a number of people in other denominations, and these things had a very negative impact on their ministry, and several even of the ministries closed down. Indigenization is and has always been part of the assembly spiritual work. The work in Africa or any of the mission fields has always been indigenized. Here it is completely indigenized, and our little assembly is just like most assemblies at home, run by our elders and who are all African. So, but this is very different when you come to talk about medical work. And I just illustrate that you can think of indigenization didn't really apply to the Good Samaritan. He was a different he from a different place, and he took care of that man. So, what is the percentage of the UK NHS staff who are from overseas? This is, say, in UK, 20% overall. 20% of NHS staff, approximately, are from overseas. That figure is 30% in London. That's a massive 1 in 5. What is the percentage of the total Western population amongst the 20 million people of Zambia? 0.19%. And only a fraction of this are involved in healthcare. So you see, there is a considerable disparity, and we have a great need for more Western nurses and doctors to come and help. And sustainability, well, you look at what did the Samaritan give the man 2 pence, and he said he would pay more when he came back. And how sustainable is healthcare? Well, it's nowhere is it considered to be sustainable, and I think even we spend millions, maybe billions in UK on it, but still sustainability cannot be achieved. So those are things that we can't really do, and yet here at Chitokoloki, we treat people for free. All our care is free, and as the Lord has enabled us to provide these things, we thank God for that opportunity. We have a very small expatriate number of people, but we do our best to help as many people as we can. So when I think of the Good Samaritan, I don't really think indigenization and sustainability are good terms for medical missionary work in Africa. That's one of the reasons the roads, that's not actually in our area. It's about maybe, I suppose, maybe 100 kilometers north. But this was a vehicle went out recently to pick up, I think it was a pregnant lady, and they had difficulty getting there. The problems with healthcare, there are many. The maternal mortality rate in Africa, in Zambia, is 10 times, no, 15 times more than the UK. I think it's something like 132 mothers die every 100,000 deliveries. We did a post-mortem on a lady yesterday who had ruptured her uterus, and she had died in childbirth because she was 12 hours away from the hospital and couldn't get there for various reasons. But there's a huge maternal mortality, and this is reflected throughout Africa. In DR Congo, it's many, many times more than 10 times, probably 100 times. So tremendous need from a medical standpoint in these places. I want to leave a few points with you this evening for your prayers, and we'll just go through them as we come to them.
David, I'm so sorry. Are you, sorry to break your flow, are you able to just share your screen so that we can see the points? Is that okay? Sorry. If you go down to the bottom and share the screen, is that all right? I'm so sorry.
I can I do that from here?
Yes, if that's okay. If you hit share down the bottom and then share your screen that you're looking at the
Right. I don't
PowerPoint, if
have
that's all
that
right.
on board. I don't have it. What is the problem? I escape. Hold on a moment till I see. I escape from this, and now I've lost the Zoom thing. Is the problem?
If it's a problem, that's absolutely fine. Sorry, I didn't want to break your flow there, but
No.
where it's not sharing at the moment.
I wonder why that is. So,
That's okay. If it's a problem, that's absolutely fine. Just leave it and
hold on,
just
just
continue on.
all right.
Sorry.
I'm making progress. What about that? Share and share again. Does that seem better?
That's looking good. Yeah, that's perfect. Thank you.
Right. Okay. I'll just run back a little bit there. But now my projector's not really doing its work. There they are. So did you see this one at the road?
We've not seen those. No, sorry.
Okay.
Brilliant.
Okay. Well,
That's
you've
great.
heard what I said. That's
Brilliant.
the
That's
that's the
fair. Thank
road.
you.
You got what I said, okay?
Yes. Yeah, that's brilliant.
Okay. So that's one of the road, as I say, and it's a bit to the north of us, but even our road was cut recently, and the ambulance couldn't get out. Um, so these are the prayer points and points for Thanksgiving. And first of all, I'd like to mention to give thanks for the lives of some people who have passed on just in the past 2 or 3 months. We've actually had a very difficult time here from an emotional and standpoint. First of all, our dear sister Jill Ngangula, who was a nurse. Jill was a wonderful person. She was a Zambian sister, and she had nursed at the hospital, I think, for over 40 years. And she led many people to the Lord. And she would often come and tell me about people that had trusted the Lord. And just one of those very special people. And she died about 4 months ago. And then there's her sister, June Spicinger, a missionary sister from America, but she worked here for over 40 years here in Zambia, around 40 years. And she died at the hospital here after a long illness, but a wonderful person. And then there was our brother Boston, who was the administrator, assistant administrator at the hospital, and had a, he died suddenly. Within the space of 24 hours, we had the death of both Boston and June, and so that was June's burial service, and that was Boston there. And you can imagine the impact this had on us in December. This was at the beginning of December, where we lost these two people very, very quickly. Boston's loss has left us without an assistant administrator, and that has meant a big, heavy workload falling on Gordon Hanna again. And Gordon has been hoping to ease back on things, but he's now back in the full swing of it. So give thanks for these brothers' life. Boston was he worked with us from 2008 and had a big impact on the hospital work and was a very good speaker. He did a lot of the evangelism and he did a lot of work at the conference center, our new conference center. Died suddenly in his early 40s, leaving his wife Lydia and three young children. So pray for those that are left behind. Brother Jeff Spicinger in Deepalata. So then give thanks for the new hospital buildings that have gone up. Um, they're it's quite an amazing structure. It looks quite out of place at Chitokoloki. It's like something you might find in London or something. But we're very pleased and proud of it in some ways. And that's that's it, the building from the outside. And we have this is our new clinic. We used to have about 4 or 5 doctors in one room, along with several patients. They'd be pulling teeth in one corner. We would be examining patients, and then we would in another part of the room, and we'd be examining eyes in another part, maybe 3 or 4 doctors at the same time, plus 3 or 4 nurses, plus 5 patients. So you've no idea what a blessing this building is to us. And it looks really very, very nice indeed. Um, this is the new ward. We haven't opened this one yet, but you can see it's very extensive. Our present ward is filled with floor beds, mattresses lying on the floor. Even we have mattresses in the corridors, and that's the male ward or the female ward, and this is the other side. So all very nice, and we're hoping to get it into action soon. The I should say that well, that's just what we've done last year, 2024. Total surgical procedures was 1497, major surgical procedures 527, minor that should be total. I think it's something not quite right there, but they're quite a lot of work. The total is 1497, and you see the hospital work at the hospital. It's 24 hours a day. It's 7 days a week. It's 52 weeks a year. It never stops. And so you never know when something's going to come in or what's going to happen. The All of our work is linked with the preaching of the gospel, and I could run over quite a. I don't have too many slides, but just to give you an idea, I preached this morning the gospel over the hospital intercom to all the wards. That was at this morning in Lunda. The many speakers take part. John, who runs the ticket office, he speaks on Sundays or Saturdays. Chipopo, who's in charge of the supervision, he speaks on usually Thursday. And Andre, our brother from Canada, who's just joined us, we had a brother over from Angola, so he gave a message in Portuguese over the intercom the other day, and some other person translated on the wards for it. So a lot of gospel goes forth over the intercom. We have a sister Rhoda. Sister Rhoda, she does a lot of personal work around the hospital. We were coming to the third patient in the male ward. And she says to me, "Doctor," she said, "this man trusted the Lord after I spoke to him," and that was just 2 weeks ago. And that happens many times. Rhoda, pray for Rhoda, who does a wonderful personal work. The message from the assembly comes across from the hall on a Sunday, and it's broadcast to the wards when the machine is working. There's multiple tracts and calendars given out all the time, and the patients just often sit on the bed and read these. We pray with our patients in theatre before the surgery. Dr. Chibwe will often speak on the ward itself. He's got a white board, and he'll give a gospel message and speak from the board. We've devotions with the staff twice a week, either Mr. Hannah, myself, or Dr. Chibwe, and there'll be maybe, I suppose, 30, 40, 50 nurses there. Student nurses come to us from various places, and today we have about 25 of them, and they'll be in to hear the gospel message tomorrow. So there's, even in theater, we have a video screen showing a gospel clips. So there's a lot of gospel outreach at the hospital, and that's our main focus. Then give thanks for the hospital work itself. This is I don't know the clock, so I think it's about 1:30 or so. A lot of it takes place in the mornings, early morning, and that's a very good theatre. We've now 2 excellent theatres. This man he came to the hospital blind. He had his cataracts done, and this is just last week, I think, also. And he was all delighted. He came in seeing. He had a little tract with him, and he opened it, and he read from John 14, verse 6. Jesus said, I am the way, the truth, and the life. And he was able to see enough to read that clearly. So we thank God for these things. And he went home praising God. So what have we? This one is Rebecca working with Andre, and they're doing an operation. Rebecca Helam is a sister from Northern Ireland, and she has had a lot of things to do when she's here. She's multi-purpose, multi-talented. She does diabetes and assists in theatre and various other things, and is hoping to come back and join us soon. So we would encourage young people, young nurses, sisters like this, to come out to us if it's all if the Lord opens up the way. It's not all hard work, as you can see. There's Rebecca having a birthday cake, and it's just as nice a cake, I think, as you would get anywhere else in the world. Babies keep us busy, very small babies. We had a tiny little baby there just about a month ago, 850 grams. And I didn't think it would survive. But Dr. Ross here, Dr. Ross Jefferson from the south of England, she's tremendously, and the staff, our Zambian staff are brilliant looking after babies. And this little baby now, I think it's up to 1.5 grams. And we're hoping that's not this baby in the screen, but it's another one, and we hope it's going to survive. So these are the sort of things that give us great joy. And it's not just that they happen, maybe once a week, but this is every day. These things are happening. It's hard to describe. You see something wonderful almost every day, and we thank God for what He does and for the provision that you folk make as well, and make these things possible for us to do. Who's this character? I think this is Johnny, and if he told you he was working when he was over here, it was maybe a different kind of work too. He did a lot of surgery. Actually, he kept giving us advice about how we should do things. He's quite an expert in medicine and these things. Stuff that we have forgotten for a long time. But he was a great blessing to us, and we enjoyed our time with him. And here, Rebecca's, we call this her Rolls Royce. It had broken down, and Johnny had come to the rescue with the tow rope and the bike, and he managed to tow the vehicle home. So it wasn't all medical work that he was doing, but we'll hear from him anyway in due course. There's another little boy, went home about a month or so ago, and you can see from his head, a little Angolan boy sustained a terrible injury. He came off a bike, and his whole head was cut open, and a stone had went right into and penetrated the lining of the brain. And we operated on him, and he had a pretty stormy post-operative recovery. He had various fits and things, but there he is going home after maybe 2 months in the hospital, and going home well. And again, we're very, very happy to see those things as he waves goodbye. So time is gone here, but I'm going to leave those prayer points with you. Give thanks for the lives of those people, our dear sisters, Jill Ngangula, Jim Spicinger, and Boston, who was our assistant administrator. It's left a big emotional toll, to be honest with you. These people were dying at the same time as the hospital work was going on, and then we had to speak at the funerals, and I found it quite difficult, and as did all of us. Give thanks for the patients who hear the gospel every day, and for those who profess salvation, that they might walk in the ways of the Lord. Give thanks for these new hospital buildings. They're a tremendous blessing to us and our patients. Remember the great need for missionary doctors and nurses. Don't believe anything about indigenization, because it's a very false idea. There is a great need, great welcome from the government, a great welcome from the believers, and tremendous need for more missionary nurses and doctors. We have 12 large hospitals amongst the assemblies from in Congo and in Zambia. And I don't know how, I think I'm maybe the only missionary doctor amongst all 12. So the need is colossal. The country here has 10% HIV, and it's just colossal need everywhere you look in this in Zambia. But Congo is again 10 times worse. And do pray for Congo and Malongo, where we were before. Number 3 there, pray for the need for a hospital administrator. Very important that now that Boston has left and gone to heaven, tremendous need. If anyone, even older person who feels that they could do this work, contact Mr. Hanna, because Gordon is completely overwhelmed with the workload. Pray for Dr. Andre and Felicia Truter. They're Canadian docs. Andre is a Canadian surgeon, and he and his wife have been commended. They're with us at the moment. They're going to work maybe for about 2 months here, and then they're going home for 2 months and then back. So he should be here 3 times this year, and then hopefully coming out all together. Andre is tremendously gifted. He'll take our work to a whole new sphere. Today he did laparoscopy, and we don't. Myself and Dr. Chibwe, we're not really into that technology that is as big as that. And he does a lot of gastroscopies, banding of varices and things. So pray for them both. Andre spoke in the ministry yesterday in the assembly. Lovely believers, and we give thanks to God for them coming. And the last one there, that we may be workers together with God. I put that workers together and then with God, because pray that we all work together in harmony with each other. Sometimes you get if you're working flat out, and it's very easy to get out of sync with each other. And pray that God might give us the grace to always be workers together and workers together with himself. And again, a word of thanks to you at MMN for your huge contribution to this work, which still continues and has been a great blessing over the years that are past. So thank you.
Thank you so much for that, David. I mean, as I said to you before, every update that we get from Chitokoloki, I can't believe that you guys can cope with how busy things are every day. I mean, it's a lot of stories of joy, but a lot to be praying for as well. So thank you so much for what you shared this evening. We're going to hear from what David's labelled as the medical expert now. So we're joined by Jonathan this evening, who we were able to support on his medical elective to Chitokoloki at the end of last year. So Jonathan is obviously a medical student at the moment, and he's going to share a little bit this evening about his experience at Chit on his elective. So thank you so much, Jonathan.
Hello, can you hear me?
Yes, we can hear you. Thank you.
Well, thank you for the introduction. I don't know about any medical advice, to be honest. Even if I did give any, I'm pretty sure it wasn't received. No, I don't think I have any advice to give, but I did have a very good time when I was out. Yeah, I'm Jonathan. I'm a fifth-year medical student in the University of Aberdeen, so I'm in my final year, so I'll be starting work soon. And I was out in Chitokoloki as part of my medical elective. So we in most universities, medical schools will have a period set apart for students to usually go away or go abroad, or not always, but often to go abroad and experience medicine in a different setting entirely. And I chose to go to Chitokoloki, and I'm very thankful for the support I received from Medical Missioner News and for the welcome as well when I arrived. To help me tell you a little bit about what it was like, I hope just to speak for maybe 5 or so minutes, nothing too long, and I have some photos I thought I could share and just briefly chat about the time there. It won't be anything too complicated. Hopefully that will be good. So I'll see if I can share my screen. I should be able to. Just working on it. Now, does that work?
Yeah, that's perfect. Thank you.
Brilliant. So here we are. This is the first time I stepped foot in Africa, and this is the first photo I took of the plane that took me there and the airport in Lusaka, there, the capital of Zambia. Before coming to Chitokoloki, I had never been south of the equator, and I'd never been to Zambia, let alone rural Zambia, which is where I was headed. So it was all very new experience. And if I was to summarize it, I think in one word, it would be eye-opening. The whole thing was very eye-opening to actually see firsthand what it's like to live and work in a place like Chitokoloki, and what the general kind of, I guess, I don't know, the how things go and how things run. So that's the arriving. I was able to stay at the Flight House, which is like a missionary house for people traveling through. And it was a very nice time. I was well looked after. That was the first meal I had on arrival. I thought I had to share that because it was just amazing. A nice T-bone steak. I mean, I ate better there than I did at home as a student. So it's definitely a strong reason to return. And so that was excellent. And I was there shortly, and then going to bed, I was advised by my aunt who used to live out in the region in Zambia, and she told me before going to make sure you check underneath your pillow before you go to sleep every night. And I did, and this was what I discovered on my first evening. A nice little spider. They call these flatties, I think, because they're so flat and quite sort of sprawled out. So I thankfully did check. Otherwise, I think I would have had an extra insect sleeping with me. So that was good advice. And if anybody ever does go out, make sure to check under your pillow in case you find a spider. So that was a good introduction for my first day. I left the next morning quite early to go up north to Sulawesi, which is in the north part of Zambia. I should have got a map and I could have shown you. But it's about an hour on the plane, and it makes the journey to Chitokoloki a little bit shorter. Which is this is where I was staying in Chitokoloki. So to get from Sulawesi to Chitokoloki, it's about a 10-hour drive. So I was very lucky to have Dominic and Nyondo make that journey. There are people who work there in the laboratory, and they drove. I think they were doing some errands and sorting out one of the vehicles, and they took me back on the return journey. So that was an interesting time. 10 hours in the car on roads that sometimes were nicely and perfectly tarmacked, and then all of a sudden it was potholes for the next 5 minutes. And then if failing that, you may find that there was just a goat or a cow, or sometimes just a pedestrian in the middle of the road without any lights or torches. They seem to have a habit of being attracted to the middle of the road, which is quite dangerous sometimes. But we arrived, and I was set up in this nice looking house. So it was for my time spent in Chitokoloki, it was very pleasant and very enjoyable. There's my living quarters and my kitchen, where I was able to keep myself fed, and but often didn't need to, as I was invited out frequently to Dr. McAdam's house, as well as Dr. Ross Jefferson, one of the other doctors there, and others. And so I was well looked after. That's the hospital as it was when I was there, with the extension still underway, as it is currently, I believe. And this was my morning commute. I would wake up and walk over that short distance. So all in all, a very, very, very easy time. So, but it was, at least for me, but it was very good. There was the pool if you needed to relax after a busy day. I didn't see much use of it, but it's a good place to go, especially when things have been very busy or very tiring, and there's been lots going on. It's a nice place just to sort of remove yourself a little bit. And we were able to have a nice barbecue here one day as well, which was great. And that's some of the views from across the other side of the river. And there's it being very dark. I mean, my time in Chitokoloki was spent mostly in the medical part of things, so that's all I can really speak to, and it was very different to what I know from being back at home. I mean, as a medical student, I'm on the ward a lot at the minute, and what I see here in the UK doesn't really prepare, or didn't really prepare me for what I would see on the wards in Chitokoloki. The cross section of disease is quite different, and the age group is much younger. There's much more. I mean, the average age in the wards in Chitokoloki is much younger than it would be here. I mean, you're talking 60, 70, 80 in the UK for most places. There, you know, the average age I would say is probably closer to 30 or 40 at times. And it's just such a completely different setting. And in that regard, it was quite eye-opening to see that. People dying much younger, people who are dying from things that really, if they were in the UK, would have been very preventable and very treatable at times. And that's not for lack of the skill and the ability of the doctors and the healthcare professionals at Chitokoloki, but often people would present late, or they would have complications with other things. Often, people would go not first to the doctor, but they would go first to the witch doctor or the healer. And then there's the travel time and the difficulty getting to hospital. So everything's it's just quite different. It's not the same in that regard. And so healthcare, you have to take a slightly different approach in lots of areas and lots of ways. So in that regard, it was very, very interesting. Of all the things as well that I saw, there was lots of animals as well. There was the ox carts that were quite dangerous and potentially deadly. So there was an owl I met whilst there. One of the nurses there, Dorothy, I think, is a long time worker and missionary out there, and she has a habit for finding and collecting sort of animals that have been I guess left or lost their parents somehow. And this one owl managed to survive and flew off, I think, one day. But of that, there was also many insects that I came across. That was another thing to fend off. I collected many in glasses. There's a nice one. And this is one that I discovered late at night while trying to go to bed. It attacked me while I was lying peacefully in my bed. This thing. But it was a beautiful place to be as well. It really can be quite stunning. This is the theatre that Dr. McAdam was speaking about, where and you saw a few photos of, where I spent a lot of my time seeing various different things and getting a lot of experience in different areas. And it was a good time. I mean, I was able to do far more there than I would be back home. I mean, the reality is that you're a pair of hands, and so you'll be used and you'll be helpful and you'll be able to do something. At home, sometimes you can feel like a bit of a nuisance on a ward as a medical student, but in Chitokoloki, you're valued and needed in times, and you're put to work, which is good, and I enjoyed that quite a lot. And it was good to be involved in actually helping and sort of making a bit of a difference there with regards to physical things. I think I took a photo there of Dr. McAdam. They were operating and doing some cataract surgery. A very satisfying procedure, I'm told, in that people come in not seeing, and then a few days later leave being able to see again, which is such a good thing to be able to give to people. And you were hearing a bit about that as well. Also, during my time there, so there's no orthopedic surgeon at Chitokoloki, no, apart from obviously Dr. Chibwe and Dr. McAdam, who can do some orthopedic operations and others. So they have what's called Ortho Week, or Ortho Weekend, I suppose, in a way, where they have one of the orthopedic surgeons from Lusaka come for the weekend. And he arrives, he does a clinic all day. He sees probably 100 patients, ranging from, pediatric orthopedics all the way up until older age. And he will then make a list of usually as many patients as he can to do the next day. I think when he came this time, he did maybe 13 to 14 operations. He began at around, I think, about 8 o'clock, 7 o'clock, early in the morning, and finished well into 5 o'clock the next morning, operating back to back. I don't know any surgeon that works that hard back home. Maybe there are, but that was quite something to see, and just, I suppose, maybe highlights the need that there is. The fact is that there was still many more patients that weren't able to get an operation that needed it, and you had to make quite difficult decisions, I'm sure, who got one. But people come with issues that are affecting them, affecting the way that they are able to live, especially kids, who are very active and mobile, and they can't do certain things, and they're able to go away with an altered path. They're able to be treated, cured in some instances, and in that regard, it's such an amazing thing to be able to be a part of, and such an amazing work that goes on. We take so much for granted the healthcare that we have. I mean, we like to grumble and moan about waiting times and these kind of things, and that may be fair enough. But in a place like this, a chance of getting an operation like that is not guaranteed, and there is no say that it's not like you'll be able to get it in 2 years. You may never. You just don't know in some regards, and you can see that the patients would turn up day after day and wait and wait and wait just to get a chance to be operated on, or to be seen, or to be treated. And so it is something I think we do take for granted, that we are able to to get so much and to be treated so well here. I was able to do a bit of my own, as I said, so I was able to do a bit of suturing, get involved. I think I did a good job. I hope so. I think this lady had a little cyst in her hand that we took out. I think she left quite happy with it. There's Dr. McAdam supervising me well, making sure I'm doing everything appropriately. I hope that maybe shows some of the trust that he had. But it was good. It was a good time. And then I cut out the bottom half here. This is, I think this was maybe 1 o'clock in the morning. There was a lady who came in failing to progress in pregnancy with twins, and essentially she needed a C-section, and so I was able to be called and help and assist in that sort of important operation. And I got a bit covered in some of the blood slightly. It nearly got under my visor, but the result was that both boys were safely delivered. And if Chitokoloki wasn't there, if people like Dr. McAdam weren't there, if all the staff there that work and volunteer there weren't there, that wouldn't have been the story, that wouldn't have been the outcome. But because they exist, because they're working away here, and like many others, you have stories like this where you actually are seeing lives saved and lives safely delivered, which is such a great thing. And of course, as well, with the physical need, there was such a spiritual need there. I mentioned a bit about the witch doctors. There is a real sense of witchcraft and sort of a spiritual darkness in certain places. And for all the good work that Chitokoloki does, my take home, my sort of experience of it is that in reality, these places exist to preach the gospel. Ultimately, you heard how the gospel is preached over the tannoy. And that's such an important part of what they do, and it defines the work that goes on there. And this is the church that we met in most Sundays and during the week, and I had the opportunity to preach the gospel there to the folks. I had a translator who I think maybe made me sound a lot better and a lot smarter. So. That was appreciated, but it was a good time, and I was very much enjoyed joining in fellowship with the believers there as well. And you had some beautiful nights as well. I've got a few photos of one night where there was this sort of thundercloud off in the distance and lightning, and it was a place where you could really marvel at God's creation as well. When the nights got dark, the stars came out, and it truly did remind you that there was a God and that he was in control of all these things. And my time eventually came to an end, and I had to get in this little plane and fly off back to Lusaka before returning to the UK. And there's the little small plane over Zambia. And this is where I am now. This is Shetland. This is as north as you can go, I think, or north as I'm willing to go for now. And I'm in there, the Gilbert Bain Hospital. That's the view from the doctor's office as I'm as a medical student there, carrying on my studies. So that, I guess, is an overview, a quick run through. Very eye-opening experience, a very helpful experience. And ultimately, I would just echo some of the prayer points, and really that there is such a great need for these places, people to go and serve, and support to be given. The work that they do is invaluable. And I've actually, on leaving at the border, the guard was giving me more questions than I had got to get in. And he was asking me where I was and what I was doing. And I said that I was in Chitokoloki. And he said, "Oh, there's a very good hospital there, very good hospital." And this is a border guard in Lusaka, in the capital, I think it just goes to show you what the work they do and how it's actually very valued by the locals. And again, the gospel work is so important, to preach the gospel to those that are lost, to those that are far, and bring them near. So I guess that's everything I had to say in my sort of short ramblings. Hopefully it's been interesting and helpful. Again, thank you.
Yeah, no, that was brilliant. Thank you so much, Jonathan. I mean, that seems to be really, a really great overview of the hospital and life that goes on there, and David's supervision skills there as well, which we obviously very trusting, David. but yeah, it's great to see that you had such an encouraging experience as well, and that you got stuck into life in the hospital. And I think both the picture of the spider and the blood spatter showed me that I wouldn't be able to cope in that setting. So we've got sort of about 5 minutes before we break out to pray for some of the things that David and Jonathan have talked about in terms of Chitokoloki. I just wondered if anyone has got any burning questions that they'd like to ask David or Jonathan after what they've shared this evening.
Kick off then with the first question. David, we saw the wards there that didn't have anybody in. When do you hope to get those into operation?
Hopefully very soon. We just don't have enough nurses at the moment. So I would hope within the next couple of months, shall we say. But they're all ready to go. And we just need the staff.
And is that because there's a shortage of nurses?
Yeah, there's always a shortage. No, not so much in the country, but you always tend to seem to run with a minimum of nursing staff. We tend to run with a minimum of everything here, to be honest. But you certainly need a minimum of nurses for each ward.
Any other questions at all before we break out into prayer? Nope, I think that's it. Well, thank you so much, David and Jonathan. I'm very, very thankful to you both. It was really interesting. And as I've said before, honestly, I don't know how you will cope with it because it just seems exhausting. I mean, especially hearing what Jonathan shared about the 7 a.m. to 5 a.m. shift. I think that would break me. So coffee doesn't cover it at that point, does it? We're just going to take some time now to just pray through that both David and Jonathan talked about this evening. And so we will break out into rooms if that's okay. And the prayer point should appear in the chat as well. Thank you.